Hi Heather, this is Dr. Maltry. Going to show you how to give Link some fluids under his skin today. So we have our bag of fluids right here. We have our venous set, which has already been primed, meaning that we have some fluids run through it, so there's no air in there. And then we have a needle on the end of that fluid line. And then we have our kitty, we have Link. So when we are getting ready to give fluids, you can either have a friend holding the bag, or you can have a hook on the wall. If you're doing it at home, a hook on the wall is oftentimes a pretty good alternative to having a second person. But we're fortunate enough to have helpers here. So Kim's gonna hold that for me. We want our bag to be higher than Link, than our kitty, because gravity is gonna help us with that. On our venous set here, we have a couple of ways to close off the lines so we're not having fluids just running through. We have this little slider where if we roll it up, that's open, and down is closed. We also have this right here, which we can have open, so you can see right here, or we can slide it over and that pinches the line closed. However you feel most comfortable doing it. I think it's easier to use the little slider one-handed, so this is usually the way I go. But after a few times, you'll probably develop your own way of doing that. So we have our line closed off. When we are getting ready, we want to make sure that Link is nice and comfortable. We're giving him some pets. We want him to be feeling good about this. I'm going to kind of pick up some skin sort of right over his shoulder blades, in the back of the neck region, because we have some loose skin right there. So I'm going to take up some skin. Usually I use my middle finger and my thumb on my left hand, my non-dominant hand, and then I pick that up, and then I just take my index finger here and I make myself a little tent, and that's going to be right where I want my needle to go. Okay, so when I'm ready, I have a spot I feel comfortable. I'm going to go ahead and take that needle cap off and just put it to the side. I'm going to pick up that skin right there, make myself a little tent, and then I'm going to push that needle right in there, right through the skin, and then I'm going to let go. When I am happy with where my needle is, I'm going to go ahead and open up my fluids. And as you can see, we have some fluids going through that line. They are dripping by themselves, but they're pretty slow. So you can have somebody, squeeze the bag like that, and that's gonna make them go a little faster. If you're doing it by yourself and you're on the wall, you can just kind of put your hand against the wall and lean, and that's going to help those fluids go. Good job, buddy. I know, you're being so patient. And our goal for the amount of fluids we want to give Link in one treatment is 100 milliliters. In this bag we have 1 liter or 1,000 milliliters, and you can see these little hash marks up here. Each of these marks is 100 milliliters. So our goal is going to be to get to that, for a second. It's going to be to get to that 1 mark right there. I know, buddy. And it's not an exact science. If we go a little over, a little under, that's going to be okay. And sometimes Link is probably going to say, I'm done for the day, and that's okay too. Yeah, good job, buddy. Good job, buddy. I know. I know. So we're a little below that 1 mark, and I think we're getting a little antsy. So we're going to go ahead and close off our fluids. Perfect. Thank you, Kim. And now that we're done giving them, we can put that bag down. And I'm just going to pull that needle straight out. And he has a little fluid bubble there that should go down in a couple of hours probably. I know we've talked on the phone, you can sometimes see a little bit of leakage. That's okay. So after we have used this needle, we don't want to use it again. We want to get a nice fresh needle on there. So best thing is to develop a system I usually like to know that I have a clean needle on there at all times, so when I am done with my fluids, I'll go ahead and I will take this needle off, and all I have to do is untwist this right here, and then we have a fresh needle waiting, and we'll have some to send home with you. You can just twist off that plastic bit at the bottom, clean needle, then we put that on here, and then we just screw that in there, and then we're ready for our next fluid administration. All right, good job, Jeannie.